when you come to see me, you're going to avail yourself of a level of skill that's just not available out there. And that's based on having seen tens of thousands of patients over a period of more than 30 years. We have the results. For example, over 3,000 men with early stage prostate cancer treated with full courses of radiation therapy, never a one ever having to undergo colostomy or ileostomy for serious bladder or rectal injury from our treatment, not a one. Incredible cure rates for the most complex head and neck cancers, really tremendous treatment. We do it right, we do it with an extremely high level of care, and every single patient, once they're finished with treatment here, gets followed. They're given a follow-up visit. I actually follow my own patients. A lot of radiation oncologists don't follow their patients anymore. I know of someone, he was just complaining to me recently. He had gotten treated for prostate cancer, and he said, you know what, they don't follow me anymore. They never see me, and when I do get seen, on the rare occasions I do, I don't even see a doctor anymore. They just do my PSA, there's no exam, nothing. I'm very concerned about the level of follow-up. Well, I follow all my patients. Following your patients once you've treated them is one of the most important parts of your program. That's the only way you can determine the quality of your care and to develop and refine your treatment is by seeing how your patients actually do over time, not just short term, but long term. And also by following patients, you can help to prevent issues from arising which can lead to problems in the future. You can diagnose other entities. If they develop a problem that is related to the treatment, you can troubleshoot it, manage it without them having something done to them that could harm them. Certain types of patients with cancer are also, unfortunately, more prone to developing other types of cancer. So it's important to be followed by someone who understands cancer and understands cancer management. So oftentimes, other types of doctors who are not involved in cancer care don't recognize subtle signs and sometimes not so subtle signs that someone might have something happening that might indicate that they're developing another form of cancer. So it's extremely important to follow patients, and we have diagnosed on numerous occasions second unrelated malignancies in patients who had other types of cancer that were perhaps related. When I was at Sloan Kettering, we were taught to follow our patients. This is a very, very powerful treatment, and the person who follows the patient who's treated with radiation therapy should be the radiation oncologist who understands what the results of radiation therapy are, who understands what the normal tissue changes are and what to look for, and it's for the patient's ultimate safety and best interest to continue to be followed by the radiation oncologist once they've gone through a course of radiation therapy, both in terms of judging the effectiveness of the treatment, assessing the effects on normal tissues, and also to be on the lookout for recurrence and other forms of cancer. And that's not being done commonly in a lot of places now. I can tell you that they're going away from it, and especially in radiation oncology, the radiation oncologists are frighteningly moving away from follow-up, which is a vital, vital part of care. Again, if they're not following, they can't know whether or not their treatment's doing any good anyway. They can't know how good their treatment program is in the first place if they're not following the patients adequately.